I'm Elizabeth Giese. I'm a family physician with Duly at the Wheaton Clinic and also at Wheaton North. I served in the U.S. Army and was stationed in Germany and served in Baghdad, Iraq from 2006 to 2008. Less than half of veterans get their medical care at the VA, which means most of them have community primary care physicians and medical care. There's also a good number who do a mix of the two. But I think one of the more important things is asking your patients if they're veterans. What I've done when I've realized someone is a veteran is I tend to do a little yellow sticky note for myself up in the upper corner that reminds me. I would encourage veterans to let their doctors and therapists and nurses and their healthcare providers in general to let them know that they are a veteran. The tendency on active duty is to just try to keep going and push through and make things work. So a lot of things get pushed to the back burner, and once you're out, suddenly there's not a military treatment facility to take care of these things. And it's different navigating the civilian medical system when you've been used to the military medical system where everything is included and all in one place. And suddenly you have to figure out insurance and how to find a doctor and how to get to specialists. So just asking the questions, bringing up problems you have. There often is help, you just need to learn how to navigate the system.
Hi, my name is Amy Washington. I was in the Marine Corps for about 5 years, active duty, stationed in Okinawa, Japan. After my Marine Corps time, I spent 3 years in the reserves for Marines, and then after that I chose to join the Army Reserve. Over the years, I have accumulated many resources to help myself and other veterans, and now I'm honored to be the community resource group leader for the veterans here at Duly. There's so many ways that you can help and honor a veteran in your community. Such ways would be to even write a letter if you know one of your neighbors is a veteran, a family member. Say thank you, the simple kind act of just saying thank you. A lot of veterans wear like a hat or a t-shirt that represents the branch of service that they served for our country. And just a simple thing as seeing one in a grocery store and saying thank you for your service. That means more than you can ever know. The one thing that I do hope and wish for all veterans is to have better understanding and good communication with each other, with their loved ones, with their friends. I do wish that we could give out more knowledge, way more resources for people, and just direct them to the right place to get the personalized care that they may need.
Hi, my name is Zoe Kreiner, and I am the founder and CEO of Support Over Stigma. And we are a local nonprofit that works with active military families, veterans, first responders, and all of their families really that battle any kind of mental health or service-related challenges. A year ago, I was approached by a female Navy veteran who asked me if I would consider speaking to the Veteran Resource Group at Duly. And I was so honored. They came out and helped us pack care packages for deployed troops. They've come out and volunteered at a couple of our events, including most recently our stair climb. And it was so amazing to have Duly there with us volunteering and doing the climb. And just seeing everyone's faces, knowing how much support comes from within our own community. The simplest, easiest way to support veterans in our community is just be there for them. It takes 10 seconds to send a text message. I'm here for you, how you doing, thinking about you today. It can be just simple as that. It can be seeing a couple of veterans in their veterans cap, having a cup of coffee and pick up the tab for their coffee, thank them for their service. Volunteering with an organization like Support Over Stigma, helping pack care packages for deployed troops. Key is, whatever you do it from the heart.